morning, folks. Welcome to another edition of The Healthy Way right here in Love 101 FM, the family station. It's a Tuesday. We go to the dentist on a Tuesday. Today, we're talking about 10 causes of periodontitis that go beyond oral hygiene. Well, you're brushing your teeth, so why do you have gum disease? Knowing the various causes can help with prevention and gum disease treatment. With us this morning is my good friend, Dr. Dana Mitchell. Hey, Dr. Dana, how are you? Welcome.
Morning, morning.
Good to have you. You look nice. I like the blue.
Thank you. Thank you. Decided to sleek it back this morning.
Lovely, lovely, lovely. All right, so what say you? What do you want to say to that?
Okay, so as a dental professional, I sometimes have to tell my patients unpleasant facts about their teeth and their gums. So when patients swear that they practice good oral hygiene, sometimes it's a little difficult to advise them that they have gum disease because they're just like, how? And this gum disease is an infection of the gum, and the gum helps to hold our teeth in place.
Right.
So there are many reasons for gum infections, and periodontal disease is caused much more than poor oral hygiene. So gum disease is the same thing as periodontal disease, if you hear us switching in between today. So let's take a look at some of the causes.
All right, and genetics is one. Let's start with that one.
Okay, so genetics. That means it runs in the family. So a family history could make you more susceptible to this oral bacterial infection. So if you think you could be genetically predisposed, diligent oral hygiene again becomes much more crucial. And how can you tell if great grandma had shaking teeth by the time she was 40 and grandma had the same thing, mommy had the same thing? You may want to talk to your dentist about this running in your family.
All right, aggressive bacteria.
Okay, so we have different types of bacteria in your mouth. And so some patients acquire what we call virulent bacteria, which is the bacteria that causes gum disease. It's a destructive type of bacteria. So it destroys your gums, it destroys your bone, which also helps to support your teeth. So this in turn can cause bleeding, bone loss, and then if you have bone loss, you're gonna have those shaking teeth. And so sometimes these patients have pain. And so depending on the stage that they have the gum disease of, then the oral hygiene treatment is based on that.
All right, medications
And,
is also
and
a factor.
before we move on to medication, I just want to say if you do have a case of the aggressive bacteria, it cannot be treated at home. You have to visit your dentist. Okay? You have to visit your dentist. Medications. So a multitude of medications can cause or lead to bleeding issues or enlarged tissues. So some of these that have the enlarged tissues are some patients who are on the hypertensive medication. So if you have high blood pressure and you're taking, for instance, nifedipine, then your gums tend to get enlarged. It's one of the side effects. So other medications can also result in, you can answer this one, Chevauni.
Right, I know this. I can also, um, you have to help me out. Right,
Dry mouth.
dry mouth.
Talk about this all the time.
Dry mouth. Yeah, I knew it.
So right. So with dry mouth, of course,
Yeah.
bacteria loves. They love moist environments, but they also love when your teeth are dry because guess what? They can stick to your teeth. They stick to your teeth much easier. And of course, in turn, cause cavities and or eat away your bone, right? So long-term use also of liquid medications such as antacids and cough drops that have sweetened sugar can also make your oral hygiene routine much more important, right? Because you also have those are most times are artificial sugars that you're taking in with the medication.
Right. And then there's another one, smoking. I don't know. I don't know why people still do it, but they do it. So smoking is also a factor. Yeah.
Yes, so smoking is a thing, unfortunately. But if you do smoke, use tobacco, including cigars, pipes, the chewing tobacco, e-cigarettes, and vaping, which is not only very terrible for your overall health and your lungs, but it's terrible for your teeth,
Mhm.
right? So you are 3 times a greater risk of getting gum disease when you smoke. And when you smoke, it actually slows down your natural tissue healing process in the mouth, which makes it more prone for infection.
Right, right.
So you really just want to put that cigarette down or whatever you're smoking down. Lay it down before the Lord.
All right. And then there's pregnancy and hormonal shifts, I gather. Yeah.
Right. So, female patients are more likely to go through this, of course, because males don't get pregnant or have menstrual cycles. But because of hormonal fluctuations, the gums are more prone to gum disease. Active periodontal disease is actually something that's really common in pregnant women and has been linked to complications such as low birth rates and premature birth. So it's important for you to ensure that you have good oral hygiene during your pregnancy, before and during and after.
Mhm. Okay. All right. Fair enough. Nutritional deficiencies.
Okay, so now you can tell me one vitamin that we definitely need to keep healthy gums.
Vitamin C.
Yes,
Yeah.
at least you remember something today. Vitamin C, very important,
I
right?
mean, the first one caught me. I'm back on track now. You know, I'm good. I'm good.
So, bleeding gums, of course, can point to gingivitis, which is a very early stage of gum disease. But bleeding can also indicate a deficiency in vitamin C.
Mhm.
So, adding healthy foods like carrots, sweet potatoes, and oranges may help. Poor nutrition in general can affect the body's immune system, and we know that vitamin C is great for boosting the immune system.
Right, right, right. And then, boy, I think age in everything. So age is also a contributor. It's also a factor. We can't leave it at all. It's with us. So
Same age.
age is a factor. Yeah.
Right. So gum disease increases over 70% in adults who are over 65 years old. So that's something to denote with age.
Mhm.
It
All
speaks
right.
for itself.
Come again. You broke up a little.
I said it speaks for itself.
Speaks for itself. Yes. And then we know this one. Poor brushing techniques.
So poor brushing techniques, you want to ensure that you are brushing day and night, at least twice a day,
Mm.
right? Once a day brushing simply isn't enough. Skipping nighttime brushing allows plaque to grow and multiply undisturbed, right? Because you have a reduced salivary flow at night, which means the teeth are more susceptible to bacteria from
Mhm.
the tiny food particles that are stuck in the teeth during the day. So not only do you have that happening, but you're going to wake up with bad breath in the morning, which is a terrible consequence. Nobody
Yeah.
wants to have bad breath in the morning. But also, if you're not brushing and if you're brushing too hard, you can cause gum recession, which is when the gums grow back. And you can also have pockets in your gum where bacteria can easily build up.
And you
And
can also disturb the enamel.
right.
Yeah.
And this also means that you need to be brushing for 2 minutes every day. So you
Yeah.
put on your favorite song. So in total, 4 minutes every day because it's twice a day, right? Put
Right.
on your favorite song. You may think that okay, this is long, but 2 minutes is a really long time. And you don't want to be doing the proper brushing techniques and leaving out the flossing,
Right.
right? We
Yeah.
want to make sure we're flossing at least once a day,
Yeah.
right? Even if you see blood when you're flossing, you should continue to have it as a daily practice. We
Mhm.
recommend using the dental tape floss and not the picks, if possible, because the tape floss is the best one that reaches down into your teeth. Okay.
All right. And then a number of people have overall health issues. So that too can be a problem.
Yes, so persons who are diabetic or hypertensive or have any form of heart disease, persons who have rheumatoid arthritis are three examples of systemic diseases that cause inflammation, and that can actually worsen the gum condition. So
Right.
there have been numerous studies in the last few decades that have linked gum disease to the increase in those same diseases, right? So harmful bacteria in the mouth are thought to travel from the mouth into the bloodstream and furthermore into your lungs. So we want to make sure that we are following up with our doctor and following up with our dentist also to make sure that everything is in check.
Okay, and let's do solutions. Gum disease treatment. How can we fix things?
Right. So the first treatment would be for you to get a cleaning at your dentist, and not just a regular cleaning, but a scaling, what we call scaling and root cleaning. So usually you have to require anesthetic for this procedure. So we're
Mhm.
going to numb you up, and then we're going to go below the gums and clean the bacteria out. And so this would be scheduled by your hygienist or by your dentist over a period of time, depending on the severity of your disease. You also have laser therapy, where it's minimally invasive and it vaporized the diseased gum tissue while leaving behind the healthy tissue, which also helps. This is especially important in patients who are like on blood thinners, so patients who have heart disease or those who have long-term diabetes, because we don't want them to be bleeding a lot in the chair, right? So it's, and the periodontist, who is a specialist, the gum specialist, is also very crucial in this on this journey to being healed from gum disease. Office education, oral health education to the patient should be reinforced at all times. And remember, your oral health is very much linked to your general health, so make sure you take care of both.
Great. Beautiful. What a mouthful this morning. I tell you, we learn something new every Tuesday.
Every
Okay.
Tuesday.
Yeah, how can we find you again, Dr. Dayna, as a rep?
You can find me at 88 Barbican Road, Unit 12, Barbican Business Center. You can find us online at Pure Smiles JA, and on our website is puresmilesjamaica.com.
Thanks, my friend. Have a great day and keep safe. Keep up the good work.
Thank you, Shivani. Thanks for having
Great.
me. Bye.
Wonderful. Dr. Dayna there from Pure Smiles. Yeah. Yeah. Well, I tell you, we learn something new every week. 10 causes of periodontitis that go beyond oral hygiene. You're tuned to Love 101 FM, the family station. Stay with us now.